Assalamualaikum dear students. Today we will be discussing about polycythemia. Polycythemia is basically increased number of RBCs and it is of two types. One is primary polycythemia, also known as polycythemia rubra vera, and the other one is secondary polycythemia. First of all, what is primary polycythemia? In primary polycythemia, the prime cause of this polycythemia or increased RBC production is present in the bone marrow, which leads to a myeloproliferative disorder, that is increased production of RBCs from the myeloid cells. Now, to understand the mechanism, how does this occurs? Let's see, this is a bone, the long bone having a bone marrow, and we have a myeloid stem cell over there. And on the myeloid stem cells we have a erythropoietin receptor, to which an erythropoietin gets attached to and causes the activation of a cascade of reactions which involves JAK2 STAT pathway, leading to proliferation of the RBCs. In primary polycythemia, what happens that there is mutation of this JAK2 response, which causes an increased response or excess response of this pathway towards the erythropoietin, leading to an excess formation of RBC production. Now, to understand it in a more detailed way, let's see what happens to this JAK2. The JAK2 pathway undergoes a mutation, to which there could be any cause. After this mutation, the pathway becomes hyperactive, hyperresponsive towards the erythropoietin. No, regardless of its concentration, either it is low or normal, it will lead to a vicious or a high response of this pathway towards the erythropoietin, leading to an excess amount of RBC production. Due to this increased RBC production, there is increased viscosity of the blood, as there will be more formed cells. So, due to this increased viscosity, what will happen? Due to the increased viscosity, this will lead to decreased blood flow to the retina. So, the patient will present to us with visual disturbances or blurring of the vision. Now, due to the increased viscosity leading to decreased blood flow towards the brain, which will cause the patient to have recurrent episodes of headache. Due to the same reason, that is increased viscosity leading to decreased blood flow towards the different areas of the body, will cause ischemia, which is a condition in which there is decreased blood supply and nutrients along with oxygen to the tissues. So this ischemia will lead to myocardial infarction. In a layman term, it is known as heart attack, gangrene, which is bluish bluish discoloration or necrosis of the tissues, and the patient may also present with cerebrovascular accident if the ischemia occurs in the brain. Then, due to the same in decreased blood flow, there will be due to this sluggishness of the blood flow, there will be increased chance of forming a thrombus or an emboli in the blood vessel, which will again lead to MI, gangrene, CVA, or a deep venous thrombosis or pulmonary embolism. The blood flow decreases, which leads to hypertension as a response of decreased blood flow to different tissue will occur. So the patient will present with visual disturbances, headache, may present with hypertension, and a few disorders like MI, gangrene, or CVA. Now let's talk about the secondary polycythemia. The primemost cause behind the secondary polycythemia is hypoxia, that is decreased blood supply decreased oxygen supply to the tissue. The cause behind it can be due to high altitude where we have less oxygen concentration in the atmosphere. It can be due to cardiac diseases which will cause decreased blood flow to the tissue, and it can be due to pulmonary diseases as well, which will then again lead to decreased oxygen supply to the tissues. Due to this hypoxia, there will be increased production of erythropoietin from the proximal convoluted tubule, which will cause increased proliferation of the RBCs from the myeloid stem cells, and hence will lead to polycythemia, which is of secondary type. How will we be able to differentiate between the primary polycythemia from the secondary polycythemia? This is very simple, and if you know the physiology, we will be very much able to differentiate between the two on the basis of investigations. Number one, as we can see in the primary polycythemia, the erythropoietin levels will be either low or normal, as the cause behind this increased production of RBCs is not the erythropoietin itself. So the erythropoietin will be low in polycythemia primary. Then on biopsy of the bone marrow, we will find hyperplasia, that is increased number of the cells present inside the bone marrow. Then in a few cases and mostly in primary polycythemia, there will be increase in all the progenies of the myeloid stem cells, that is the WBCs, the RBCs, and the platelets, while in secondary there will be only increase in the RBC production. How will we be treating these patients? We will be treating these patients by phlebotomy, that is extraction of the blood from the veins by giving them interferon so that RBCs may be destroyed, and we can also give them Loprin or aspirin, which causes decrease in the thrombus formation, and we have to treat these patients symptomatically depending on their symptoms. That was it for today. Thank you.